Welcome to the EMS Safety Forum, day number 2. I am here with a very, very special guest, Dr. Nadine Levick. Oh, I don't think yep, there we go, start video too. It would be helpful if folks could probably see. But just chat, comment in the chat where you're joining in from. Just put down your city, your state, your country. We would love to be taking any questions. I'll be moderating the chat. Again, my name is Robbie McHugh. I am your co-host for the EMS Safety Forum. I'm here with renowned researcher, ambulance safety expert, Dr. Nadine Levick. Nadine, thanks for joining us.
Oh, hi there, Robbie. It's a real pleasure to be joining you today with the Leadership Academy Safety Forum. Real honor and lots to cover today, so fasten your seatbelts. This is going to be fast. We're ready to go. I'm going to be speaking on global innovations and EMS safety research, and hopefully that after the next 40 minutes, you're going to leave with a whole lot of useful and practical information. A lot of what you'll hear today is thanks to the work of those in the EMS Safety Foundation, as well as the National Academies of Science, Medicine and Engineering's Transportation Research Board, AMB 10 Safety Subcommittee. And I won't spend too much time on who I am because there's much more important things to talk about. I'm actually now based in Israel, and you're going to be seeing some interesting, innovative examples from there. So we're going to speak a little bit on historical perspectives, New World Order, key determinants, innovation dimensions, how to do things cheaper, better and safer, a few words about open source and some challenges. And I think pretty much everything I'm going to speak today is reflected in these amazing comments by Colin Powell about leadership and innovation. And he says, being responsible sometimes means pissing people off by procrastinating on the difficult choices, by trying not to get anyone mad, and by treating everyone equally nicely regardless of their contributions. You'll simply ensure that the only people you'll wind up angering are the most creative and productive people in the organisation. So what's safety? Well, it's a condition of being protected against undergoing or causing harm, injury or loss. And what's innovation? It's something new, original and hopefully more effective. And what's design? The process of developing purposeful and innovative solutions that embody functional and aesthetic demands. This is my second quote. And it really does cover what we're going to cover, focused on EMS. The president of the Furno Group said, to create an innovative and model EMS system, we must engage in a collaborative and cross-functional conversation among the many contributing partners in the EMS industry. EMS suppliers should embrace and drive new innovation to improve the process and the efficiency of delivering service, while advancing the level and the outcome of emergency care. And that's what we're going to do today. We're going to go a bit from low tech to high tech and back again. We're going to talk about the system of safety. We're all going to think about the overall impact, small low-cost changes in practice that really make a big difference, policies that will augment safety, innovation in design from micro to macro for your system, and preparedness and training. Well, EMS risk and design needs used to be focused on transport rather than the medicine, but now we have a new world order. And I don't need to tell anyone this, we're dealing with the 2020 COVID-19 pandemic. And this is not what it usually looks like in New York City, but that's what it looks like now. And we have new tragic hazards for EMS that we've never really encountered at this scale before. And daily we've been seeing an increase in the deaths involving EMS providers. And as of just a few days ago, there were more than 24 COVID-related fatalities to EMS providers in the United States. So, very important principle. Ambulance transport safety is part of a system, and the overall balance of risk involves the safety of all the occupants, the providers, and the public. So how does design happen in EMS? Well, historically, tradition has taken a big role, experience, some vision, and interdisciplinary technical sciences. And we're going to see how we can try and turn that pyramid upside down. Really, the frontier of EMS safety now, maybe more than any other time, is the interface of disruptive new tech, and operational practice at all levels of the MS system and across many disciplines. I'm going to briefly speak to the hype cycle. This is where we were in 2017. I think you might be able to see my mouse. I'm not sure.
Yes,
great. And the hype cycle looks about the innovation trigger, the peak of inflated expectations, and then it moves on to. Sorry about that. This always happens when you do something live. There we go. Sorry about that. And moves on to the trough of disillusionment, the slope of enlightenment, and the plateau of productivity. Well, just 2 years ago, autonomous vehicles, drones, and augmented reality were all in the trough of disillusionment. Virtual reality was moving to the slope of enlightenment. And here we are 2 years later, virtual reality and augmented reality are out in the plateau of productivity. Drones are still sort of drifting down there, but now we've got drone countermeasures coming in. So drones are now moving into, slowly, the slope of enlightenment. So when we look at transport via EMS, it's complex, it's multidisciplinary. We need epi data, we need to have personal protective equipment, we need to have transport policies, fleet safety programs, safety technologies, regulations and standards, an understanding of risk management and even public education, as well as these technical fields of automotive safety, ergonomics, biohazard and chem research, and communications technology, a lot of diverse disciplines. I always used to say the key elements of transport safety were impact biomechanics, transport ergonomics, and fleet safety. But hey, now key is really effective PPE for unusual conditions that we're dealing with now. Safety dimensions we know about: safe systems, crew resource management and transport safety, understanding risk, how we manage our fleet and oversee our fleet operations, how we actually design our vehicles, how we make sure the scene is safe, how we handle our patients, both physical and clearly now biological hazards, our health and wellness, hours of service. A lot of these topics were covered in a big summit that we held under the auspices of the Transportation Research Board, National Academies. This is actually an interactive document, and all the presentations and handouts are freely available, and you can just scan that tag with your phone and get the document on your phone, or you can go to that link. And that's all free access, cutting edge technology from all sorts of disciplines, and please feel free to take a look at it.
And Nadine, I've added it to the chat as well, so folks can still get it.
Great. And there were 8 sessions there, and clearly this was done in 2012, so it was before the real understanding of the current crisis that we have. But we do have lots of new technologies, and we didn't have them in 2012 to the same degree. We had fleet management tools, but they're more advanced now. We've got more advanced vehicle design. We're going to talk about how you can do that safer, better, and cheaper. Improvements in visibility. We're using drones in many situations in EMS now to improve the safety of our systems and our scope of practice, particularly here in Israel. And augmented reality and virtual reality are becoming important, very important training tools. And artificial intelligence is now being used in many dispatch systems. We're going to talk about that a little more. And digital health has a big role now, and the crowd and the cloud, and we're going to talk about some of the apps that are being used here in the Middle East. First, a moment of history. In the 1980s, that was a telephone, and now we have a totally different tool. Whoa, and in the 1980s, that was an ambulance, and hopefully in 2020, we're going to see something better than what we've seen in 2019. A lot of what we're seeing is predictable, some of it is preventable, and we don't want to have accidents. In ambulance design, it's a technical science, but it's not really a new issue. In 1864, here is a patent that was submitted to the United States Patent Office, trying to optimize the safety for the patient and the provider. And that was in this sort of a vehicle. And if you were to ask questions then, what would make it safer for a horse and buggy ambulance, and what would make it more efficient? People were more likely to say more rest stations. People were unlikely, end users were unlikely to say the combustion engine. So there's a timeline to MS safety. And you know, back in the 60s and 70s, having blood on your hands and your clothes was a good thing. And we sure knew in the 80s that wasn't a good thing at all. And in the past 10 years, more so in the last maybe 5, we've seen a lot of really interesting safety innovation roll out, and our big challenge right now is adopting those changes. That's where we are. We've got a lot of information now coming from the US government, but still have an absence of technical automotive safety performance standards and oversight. We've got lots of different consensus, but not technical vehicle standards. It's a little challenging to identify best practice, lots of unregulated commercial products, no true system safety performance standards, and an absent still national safety oversight. Very interesting presentation held by this forum addressing safety standards, and I strongly suggest you go and listen to that. We gave a little presentation at NMSP on comparing some of the global best practices and ambulance design, and you can download that from the website. Clearly, we don't want to see outcomes like this. And these sort of vehicle issues are happening all the time, and we just ran into a few in the past week involving a service. But maybe with time, we will start seeing oversight involving national organisations also in the United States. We have more safety standards for moving cattle than moving patients. But we've just got to remember that the laws of physics will prevail. Here's some of the data, and as I mentioned as we opened, the situation with biohazards and biological hazards have now well surpassed the physical hazards EMS providers are being exposed to now. But we don't want to see any preventable or unnecessary hazards, even though we know there are some challenges related to the human factors. We know that with the design of squad benches and the equipment on the other side, it's hard to reach what you need. And the interior design does expose the providers to unnecessary ergonomic and automotive hazards. So safety is multidisciplinary. It involves many aspects of how we do EMS. And really, enhancing operational practice needs a system safety approach, and this is a presentation given to the International Society of Industrial Engineers. And the system safety approach when it comes to ground transport involves systems that we know and understand for looking at safety of transportation. And we need to understand how to optimize using our leadership, using the targets that we aim for, what we know, and how we engage our EMS community to minimize preventable death and injury for the safety of our providers, the public and the patient. And it's always important to remember that the safety of the provider is number one. This is not a hospital setting where the safety of the patients is very high. In EMS, the provider is the top of the pack. And safety is a tool that will save lives, time and money, and it needs to be evidence-based. We have tools that are well designed that will improve the safety for the patient and the provider. And much is now published in the science field of how to optimize our environment. There's been testing that's been performed, so we want to work smarter, not harder. We can learn from our international colleagues at international congresses, and this year, because of COVID-19, Retmobile isn't being held, and we see a lot of initiatives now that we're operating in an online manner. And here's some of the technologies that we saw there: smart technologies, design that allows you to do your work and have safe automotive environment, occupant protection environment, and biohazard environment. You're not having to reach across the patient to get to your equipment. In the design of these ambulances, your equipment's right by you. So I want to talk about some examples of global innovation. There's all sorts of fleet mix, and here's some examples from London of bicycles, segways, and gators. And motorcycle medics actually are used here in Israel as well, and here's a couple of examples of that. I'm going to talk a little more about Israel. Israel, the innovation nation, as it is aptly named. It's where Skype, Waze, and many other innovations began. But there are also innovations in EMS. Our Israeli Magen David Adom service has multiple different sorts of vehicles, and I won't go in detail through the different types of vehicles, but I am going to spend a little time on some cool innovation. They have an app, and many people in the country download the app, and it can actually transmit video, and it can also have some medical history in it. So very unique system, but not only can it transmit video, you can connect dispatch with video at the scene. And not only can you connect dispatch with video at the scene, as of pretty much yesterday, in order to deal with some of the current pressures related to COVID-19, they're actually building a pilot for 24/7 medical involvement. So 24/7, you can connect that video to a telemedicine doctor, and they can help you with some of the challenges of, is this a patient that does need to go to a hospital, or is this a patient that maybe needs to go somewhere else? So if you go to the Magen David Adom dispatch center, you can actually see real-time video from a patient at the scene or a provider at the scene that's connecting to dispatch, and they're now looking to expand that.
And Nadine, can I ask you a quick question? Can I just interject with that?
Sure.
That looks like extremely innovative. And
yeah,
what is the rough population? What is
Israel has a population of 9.2 million, and the app is it's a new initiative, but it's been there for a few years. The video aspect is relatively new, and really it's a technology that uses very secure but simple technology that any layperson can actually use, as well as with the consent of the person, the paramedics can also engage them.
And the general public is the one that downloads the app,
yes,
almost like a 911 style app.
Yes, the general public download this app, and it's got lots of very clever features. We'll talk more about that at the end, but it's a very interesting tool. So we also have some other preparedness issues here in Israel that we sort of thankfully don't have to deal with in most parts of the world. I have a bomb room. I was going to include a picture of it, but I didn't because we got too many slides. But we do have an Iron Dome that will take out 95% of the rockets, but I'm very familiar with listening to the air raid sirens and going into the bomb room. And now we have a number of incredible innovators, and I'm going to do a shout out to Ellie Jaffe, who's an EMT PhD and a truly brilliant man. And now Israel is actually training Americans on how to deal with mass casualties and disasters. And I've got to show you my absolute favorite innovation, which is like really amazing. So Moulage is a stack of $7 t-shirts. So mass casualty drills, and this is, I believe, the brainchild of Ellie Jaffe. And instead of, Israel likes to do things smarter and clever, and as I said, the smarter, better, cheaper. Well, everyone just puts on a different Moulage t-shirt and you're all moulaged up. And I just wanted to share that. I think it is really brilliant. Yeah, and you know, not all innovation is expensive, and this is just one small example of something that really is able to scale up. The other I briefly mentioned to you at the start, you know, 25 to 30% of EMS runs around the world are non-transport, and we know that. And 30% thereabouts of transports to the emergency department are discharged home within 4 hours in many places in the world. So there's a pilot right now to set up a 24/7 physician video interactive telemedicine support for both these cohorts. And this looks like EMS triage, but let me tell you, it's not. We seem to have a lot of elections lately in Israel. I won't comment on the politics. This is a voting booth, just to show you preparedness is a real issue here. And this is one of the EMS providers in full gear. And here are some special holiday packs. One of the things I've always said to folks is that in many ways, a measure of preparedness is the toilet paper available and on special. Well, here it's even better than on special. It's being given away free. And these are care packages for Passover, which happened right in the middle of COVID-19 here. And it was very important to make sure that all communities had essential supplies. And those are boxes of essential supplies and toilet paper and fresh fruit and vegetables that were delivered to communities that were in any way having difficulties getting to those supplies. The other comment I want to make is that here in Israel, it's a multicultural service. And here you see two members of the one ambulance team. One guy is wearing a Jewish prayer shawl and praying at the prayer time. And the other guy is actually praying, and he's Muslim, and he's praying in a Muslim manner. And it was just great to see that community spirit. And that was just from a couple of weeks ago. They've also got some pretty innovative fleet funding. I come from Melbourne, Australia, which is in the state of Victoria in Australia. And Magen David Adom has got an Australian branch to raise money. And these are all the vehicles that have been donated by the Australian branch of Magen David Adom. There's a big Jewish diaspora, 9.2 Jews in Israel, and many, many more outside. So after talking about Israel, I just want to have a few words about Malaysia, because it's one of my favorite places for innovation, and it's innovation done a little differently from everywhere else, because Malaysia is not a country that has the luxury of a diaspora like Israel has. So fleet design is clever, they've got a clever layout, and as importantly, they have a structured system of policy, oversight and standards. This is your pretty stock standard Malaysian ambulance. And it's designed on the interior. There's no squad bench. There's forward and rear-facing seating. And the equipment is safely and carefully secured. And sometimes clever innovation can be pretty simple but cost-effective. They didn't have the money to make wheelchairs, and so they were a little innovative about how they got around to doing that. So I'm going to talk about some aspects about vehicles and interdisciplinary infrastructure and some new technology tools. And the focus is smarter, safer and cheaper. I want to talk briefly about the in-demo, the Ambulance Safety Innovation Design Module that the MS Safety Foundation has worked on. And this is really a demonstration environment that travels around largely North America, but it's slowly making its way to the Middle East. We'll say slowly. We actually have a little telepresence robot, and this is designed so you can see the sorts of designs I was showing you that largely are in Europe. One of my colleagues, Josh Wheeler, who's a top guy from North America, and one of our interns here who's been helping us with some of our work and showing these rollout packs, which are cheaper and probably better and safer. You can just unclip them and take them out to the scene. The equipment is to the right of my colleague here, and he can reach the patient without getting out of his seat. And here you can see you can flip out that pack and put in a chair. This is a configurable environment. And here you can see one of our colleagues here actually working in the same sort of configuration that I was showing you in the European ambulances. And this ambulance happens to have that fancy stretcher that we saw right at the beginning, as well as very clever seating that will tell you whether or not the provider is in the seat and belted. Simple little things. You can put a strip of LED lights and a small 12-volt battery for 20 bucks on your stretcher, and then you can see where the stretcher is going at night. Fewer tripping injuries, fewer dropped patients. Not all innovation is going to be expensive. Voice-activated commands, we won't have time to run the video, but you'll be able to have a look at that run from the website. And also from this document here. Telematics, well, how much technology and data and what type of data do you need to improve fleet performance? There are numerous technology platforms that will give you lots of data on how your fleet is performing and how to optimize the safety of that. So next is now, fleet mix we've talked about, but hey, drones, vertical takeoff vehicles. We need to be looking at that. We talked briefly about voice-activated commands, but now you're going to hear about mixed reality, connected health and wireless patient monitoring and health information exchange. First, let's talk about virtual reality. Well, some really exciting news, pretty much just released this week. Virtual reality clearly has come into a great new space given the challenges we've faced now with COVID-19. And there is now, if you take a look at vrpatients.com, you can have virtual reality EMS scenarios that you can build yourself. The bottleneck with virtual reality has always historically been the developer and expense. And now you can bypass all of that. here are some other examples of virtual reality. I'm not going to go through all of them, but it's all a very new science. So here's just some info about vrpatients.com. I know a bit more about this than some of the others because I've had an opportunity to play with the interface, and I did this morning. I actually built a COVID-19 demo model on this platform, and I've got to tell you, it's as easy as doing a PowerPoint. Really impressive tool, and it does everything from describe the scenario, the patient you control with a few clicks, and grading and case logic. Really impressive tool. And this is sort of what it looks like in the real world. These patients look very real, and I don't think there's any other platform out there in any realm of healthcare education that is do it yourself, just like IKEA. You build what you want. CPR training, again, these tools are out there. There's some for violence training out in Australia, and there's some mass casualty training with real response, also from Australia. Those Australians, they're pretty innovative. You'll see them popping up everywhere, and that will give you a performance scorecard on how you performed in that mass casualty. And virtual reality can be used as a design tool. And here's one of my colleagues from the EMS Safety Foundation using virtual reality at Repmobile as a design tool for looking at different ways of setting up the interior of an ambulance.
And Nadine, if we could pause for a moment too, and go back a slide. I believe that a lot of this technology behind virtual reality, the Oculus, the price has been driven down pretty dramatically.
Oh yeah, I should have made a mention.
Even if you don't have the hardware, some of these VR platforms translate to the web, so you can still interact with the simulation.
Yeah, I should have mentioned that. This particular platform is designed to be both web and virtual reality. The ideal tool, there's now, Oculus Quest is a really impressive tool, very inexpensive. But yeah, this particular platform is totally fluid as far as whether you just want to engage with a PC by yourself or a laptop, or if you want to actually do the immersion. And I've got to tell you, the immersion is extraordinary, and I think this really is the tool of the future. You know, what happened here in Israel when COVID hit, the university that I'm affiliated with went virtual literally overnight. No classes, everything done online. So medical school training and EMS training clearly is going to be leaning heavily. And I really like this byline, real life training without real life consequences. And that's it. And the really cool thing is to be able to build your own scenarios to meet your own environments, or by all means use from the bank of scenarios. And one thing I don't think I mentioned is that the COVID-19 scenarios with virtual VR patients, their COVID-19 demos are going to be made available gratis to anyone who wants to use them.
Well, that's a great announcement. If anybody has any questions, feel free to put your questions in the chat, especially we're here live with Dr. Nadine Levick, and we're taking folks' questions, especially when it comes to innovations in EMS safety, and we have the foremost expert here.
Cool. So yeah, if you're interested in that, by all means, reach out to vrpatients.com. Moving right along, I don't want to go over time. That would be very naughty. AI and dispatch. We're using AI a lot more now in recognizing certain elements of calls. There's been some great work done in Copenhagen and also in Dubai looking at AI verifying breathing and breath sounds and altered breathing on EMS dispatch calls. And I think these are all very interesting projects to keep a close eye on. Wearable tech, clearly we're now in an environment where wearable tech is out there, and the day of the wires will eventually be gone and we'll be in a wireless world. I wanted to also make some comments on the crowd and the cloud. There are some very cool projects out there. Genesis Pulse is integrating ways so that your CAD knows what's going on in the field. And engagement of bystanders is an increasingly valuable project. And this is a project out of Copenhagen that really highlighted with some outstanding data that bystander defibrillation is what we need to be aiming for. And they're very active in trying to enhance the amount of bystander defibrillation in sudden cardiac arrest. Here's just some close-ups of the Genesis project there. Unmanned ambulance drones, starting to see those delivering AEDs, defibrillators, and now we're even seeing manned drones being talked about and developed. We actually have some model here in Israel as well, but this is a Chinese passenger drone that clearly is this the ambulance of the future. So I didn't want to go over time because I want to leave a little time for questions. We sure covered a lot of different stuff, but basically the bottom line, the safety of our EMS system is an overall balance of risk between the safety of our occupants, including our patient and provider and the public. Things can go wrong, but when we've got sound safety policies and technologies in place, the system is well prepared. You can minimize harm. And this was a pretty amazing day in New York. I happened to be in New York that day. So technical collaboration is key now. We're using tools that we've never even dreamt of before. We are not the experts in most of these sciences, and we need to be reaching out to these technology experts, whether it's the drone folks, whether it's the data folks, whether it's the virtual reality folks. We must have a meaningful and evidence-based approach to design, operations, training, and policy. We've got to be outcomes driven. So safety has got to be inherent to operational process, design, and practice. We need to engage disciplines well outside of EMS in systems design, transport safety, human factors, safety analysis, and technology. And an understanding of that complex interplay between our patient, our provider, and our public safety from a systems perspective and a cultural perspective is key to addressing effective, safe, and operational EMS performance. So everybody, your handout will be available to you online at that link, and you can use your phone to snap that QR code, or if you're older than 45 years, you might want to just go to the link. So with that, any questions?
Well, Nadine, that was certainly an incredible talk on safety. I'm also putting the link for folks in both of the chats if they wanted to download the slides, and you've got these great QR codes, which is amazing. So folks, type in any questions you have around what we went over today. I know it was very rapid fire. And Nadine did warn you to wear your seatbelt because it was quick, but incredibly pertinent. And Nadine, maybe we could just chat quickly about
Sure.
ambulance safety design, the manufacturing design,
Sure.
what folks are doing internationally. I think one of the big surprises when we did our live panel for folks about ambulance safety standards in the US, folks were surprised to hear internationally it could be cheaper, better, and safer. They wanted to know a little bit more about how is this even possible?
Well, cheaper, better, safer. What a great thing that is. I suppose, I'm just going to show you something here. This is, my personal pulse oximeter. I wear this on my ID tag at work, and I use it many times a day. And I remember when this thing didn't cost $25 on Amazon. I remember when this thing was the size of a shoebox and it cost $2,000. I'm that old. So technology has allowed us to do things a lot better, a lot safer, a lot cheaper. But one of the key issues that we see in Europe and also in Asia, in Malaysia, and a lot of the Asian countries, is that they're using standard automotive vans. They're not modifying the structure of those vehicles. And those vehicles, be it a Sprinter, be it whichever vehicle they're using, are built by the automotive industry. Nobody had to build the rear compartment. And so that vehicle is an integrated vehicle. It has integrated crumple zones. It has all sorts of protective structures, and it's required to meet automotive safety standards because it's an automotive vehicle. I'll quote a phrase, bumper to bumper. So when you don't have to do all that modifying, it's cheaper. And because it's a standard automotive vehicle that has to meet standard full integrated vehicle safety standards, it's safer too. And then there's some other things. People used to want lots of space inside an ambulance. When you've got lots of space, you can't reach your equipment, as we've seen, and you can't reach the patient. And, we all know that very sick patients are traveling in a helicopter, very compact space. But you can reach everything. I worked for a while with the Royal Flying Doctor Service in air medicine, and, those were compact environments, but you could reach everything you needed really easily. So sometimes less is more, and that's some pretty clear-cut examples of how we can make it safer, better, and cheaper for EMS.
Incredible. And one other fascinating thing was you had a brief slide on it, was the Furno Mondial stretcher, which I had never really heard of. A fascinating, I think, innovation that doesn't get a lot of maybe notoriety because it's not electric, it's not hydraulic. It's
an independent leg stretcher that it can be operated up and down stairs with a single operator. It's a very cleverly designed piece of technology. We actually have one in demo unit, so feel free to take a look at it there. It's one of those examples of clever design that is designed to make it safer for the patient and the provider.
Great. Well, it doesn't look like we have any questions in the chat. I'm sure folks are going to be watching the replay, so they can always comment on the Facebook Live or in the EMSSafetyForum.com. We have the videos hosted for free. Again, we've got 2 days worth of content, over 16 hours worth of content talking EMS safety at EMSSafetyForum.com. Dr. Nadine Levick, I want to thank you for joining us from around the world, for broadcasting your message of cheaper, better, and safer. And for being such an advocate for ambulance services and emergency services throughout the world.
Great to have the opportunity to speak with you all. Thank you very much, and don't hesitate to reach out.
All right, everyone. It's great to see you on the live. Head on over to EMSSafetyForum.com for more information and to see day 2's lineup of speakers that we're pretty excited about. Take care and be safe.